Welcome back to my channel. If you're new here, my name is Neil Galve. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, please make sure to subscribe now. You hit that notification bell so that every time that I upload my videos, you'll be the very first one to watch my uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, you guys, let's jump into the video. Good morning, everybody. How are you guys doing? Kumusta? Nagbabalik na naman ako para sa isang panibagong nursing lecture. I would just like to apologize. This discussion that we have for today is supposed to be for yesterday's, but I got really busy. I got caught up with, my daytime job, but don't worry because today I will make it up to you. This is another entry natin sa ating nursing pharmacology kung saan gumagawa ako ng mga lecture materials, mga nursing drug study guide. And kung hindi mo pa napapanood yung other nursing pharmacology, nursing pharma lecture, mga drug study na ginawa ko, I'll be putting the actual playlist link on the description box. Or whenever the icon button pops out, click that one out because I'll be putting it there together with some of the other nursing educational contents I have on my channel. Now, gusto ko lang i-grab itong opportunity na to para magpasalamat sa inyo sa patuloy na pagwalang humpay na pagsuporta nyo. You guys, pinastataban nyo po yung puso ko. I just learned today that 2,200 of you guys were actually subscribed to the channel. Subscribe to the channel and chooses to hit the notification bell. Maraming salamat po sa 2,200 na yon na mga tao ng Team Galve ang nag-choose na mag-hit ng notification bell para aware sila every time na nag-upload ako. Nakakataba po ng puso. At sa mga bago nating subscribers, mga kasapi sa ating team, naman, welcome po. Kung bago ka dito, ngayon mo lang ako narinig, well, I am Neil and I am a registered nurse. Been a nurse for a while. I have a master's degree in medical surgical nursing and now I am starting my new career in the ICU. Ang saya, diba? Yes. And this is one of the fascinating fascinating times and moments of my life, and I want to share that with you. I would just like to also grab this opportunity to invite you, kung hindi ka pa nagsubscribe, mag-subscribe ka na because for this month, we are really moving so fast towards 20,000 subscribers. Malapit na nga nating mahit yung 20,000 mark, you guys. Kaya naman, keep on sharing my videos and keep on tagging your friends, liking my videos. And whenever you share my videos to your social media platforms, let me know para makapagpasalamat po ako. Pasensya na kung hindi ko kayo na-replyan lahat, ha? But I just really want you to know, guys, that I really appreciate all of you from the bottom of my heart. I love you, I appreciate you, and I'm very, very grateful for all of your support. Ayan, hindi mo pa ako na-follow sa aking mga social media accounts. I have Facebook. I have basically everything. All of it is on the description box. I have a Facebook page. It's Neil Galve. The link is also on the description box. I have Spotify or a podcast channel. It's 3 a.m. Conversation with Neil Galve. If you haven't checked that out, that podcast, that show, which is really wonderful, check that because it's going to, feed your soul. I call it food for your soul. Okay? Yes, interesting. Now, going back, today is all about this medication, fentanyl. Deadly fentanyl. That's how I call it. Fentanyl, which is a narcotic analgesic, a type of opiate. Now, let's proceed na. Fentanyl, also spelled fentanyl, Fentanil, is a highly potent synthetic opioid used as an analgesic. Together with other drugs, fentanyl is used for anesthesia. It is also used recreationally, sometimes mixed with heroin, cocaine, benzodiazepines, or methamphetamine. An overdose of it can be neutralized by naloxone. The antidote for your fentanyl is what? Naloxone. Ngayon, kung speaking of antidote, drug overdose, I have created multiple videos regarding medications and their antidotes. Panoorin mo yun. I believe nasa cheat sheet playlist siya. So, yes, marami yon. Napakaraming medication nun. Ngayon, this is all about fentanyl. And let me share to you the objectives for our today's discussion. So, just like our previous drug study, we are going to have the classification, generic, brand name, route, and dose of administration, mechanism of action, indication, contraindications, side effects. And this will not be your nursing drug study if we're not going to talk about your nursing responsibilities in administering fentanyl. Handa ka na ba? Handa na. Eto na. Classification, generic, and brand name, route, and dose of administration. Mabilis lang to. Classification. Of course, you all know that. Opioid analgesics. Okay? Generic and brand name respectively. Fentanyl, that's the generic name. It is sold under the following brands: Analgesics, Durasic, Abstral, Actic, Fentura, Lancis, Lazanda, Subsys. So that's the generic and brand name, okay, of your fentanyl. Next, in terms of route and dose of administration, napakarami pong route. Meron tayong parenteral, transdermal, transdermal system, transdermal, iontrophic system, transmucosal, lethal to non-tolerant patients, lozenges on a stick, buccal tablets, spray, and intranasal. So, iisa-isahin natin sila together with the route and the dose per route, okay, per specific route. So, sa parenteral or IM or IV, primarily for induction and maintenance of surgical anesthesia, rapid onset, and short duration. Transdermal. Depende po ito sa order ng doktor ha. Yung fentanyl kadalasan binibigay ito as a form of sedation sa mga pasyenteng naka-endotracheal tube, naka-mech vent. So, in terms of transdermal system, patch applied to the skin of the upper torso, available in 5 doses: 12.5, 25, 50, 75, and 100 micrograms per hour. Patches can be replaced every 72 hours, takes 24 hours to reach effective levels, and remain steady for another 48 hours. Transdermal patch, common ito na binibigay sa mga chronic, may mga pasyenteng chronic pain o yung sa mga tawag dito, palliative care patients natin na may severe pain, yung mga cancer patients, yung may mga liver diseases, yung may mga bone diseases. Kadalasan, binibigay ito sa mga DNR patient once na nakita na ng pain management doctor. Okay? Next, transdermal ionotrophic, trophoretic system. Let me correct myself. Low intensity electrical field delivers medication into systemic circulation, approved for acute management of post-operative pain in adults removed prior to discontinue or discharge. 40 microgram dose over 10 minutes interval, used for 24 hours or 80 doses, whichever comes first. How about the transmucosal? 4 formulation po sa transmucosal. How we have lozenges on a stick, buccal tablets, sublingual spray, and sublingual tablets, approved for breakthrough cancer pain when patient already takes another opioid around the clock and has some form of tolerance. Okay, so isa-say natin to. In terms of lethal to non-tolerant patients, lozenges on a stick, ito yung mga doses niya: 200, 400, 600, 800, 1,200, 1,600 micrograms. Consumption takes 15 minutes. Analgesia begins 10 to 15 minutes, peaks at 20 minutes, and persist 1 to 2 hours. How about sa buccal tablets? 100, 200, 300, 400, 680, 800 micrograms are available. Place above rare molar, dissolve and place 15 to 30 minutes. No chew, split, sucking, or swallowing tablets. Sublingual tablets 100, 200, 300, 400, 600, and 800 micrograms, different colors and shapes. Place under the tongue of the patient and allow to dissolve completely. Moisten mouth prior to dosing if needed. Okay, so sa spray, we have the available doses 100, 200, 400, 600, 800, and 1,200 up to 1,600 microgram under the tongue. So intranasal, only for breakthrough pain for cancer patient, 8 sprays per bottle. Here are the available doses 100, 300, and 400 microgram per spray. Once again, these are the classification, generic and brand name, and route and dose of administration. That was mouthful. Okay, here we go. In terms of mechanism of action, how does this medication work? Eto na tayo. Fentanyl binds to opioid receptor, especially the mu opioid receptor, which are coupled to G proteins. Activation of opioid receptor causes GTP to be exchanged for GDP on the G proteins, which in turn downregulates adenylate cyclase, reducing concentration of CAMP. Reduced CAMP decreased CAMP-dependent influx of calcium ions into the cell. The exchange of GTP to GDP results in hyperpolarization of the cell and inhibition of nerve activity. Once again, this is the mechanism of action of your fentanyl citrate. Eto na tayo. Which patients are you going to give fentanyl? That is the indications. Eto na tayo. Clinically, its most common use is as sedative in intubated patients and in severe cases of pain in patients with renal failure due to its primarily hepatic elimination. At times, fentanyl may also be indicated to treat chronic pain patients who have developed tolerance to what? Opiates. So once again, like I said earlier, this is commonly given to intubated patients, mga naka-ET, and sa mga chronic pain patients natin. Okay? So these are your indications. How about contraindications? The use of fentanyl is contraindicated in the patients in the following situations. Here we go. 1. After operative interventions in the biliary tract, these may slow hepatic elimination of the drug. Take note of that. Next, with respiratory depression or obstructive airway disease, ano yung mga example nun? Asthma, COPD, obstructive sleep apnea, obesity, hyperventilation, also known as Pickwickian syndrome. Next, we have liver failure. No siya sa mga pasyenteng may liver failure. Why? Because your fentanyl is being metabolized in your liver, right? Next, with known intolerance to fentanyl or other morphine-like drugs, including codeine or any components in the formulation. Lastly, contraindicated siya sa mga pasyenteng with known hypersensitivity allergy. Or any common drug delivery excipients. Example nito, sodium chloride, sodium hydroxide. Once again, these are your contraindications. What are the side effects, nurses? And it's very important for you to know the side effects because these are the expected outcomes. The effects that you normally see with patients who is receiving fentanyl. So, ibig sabihin, hindi ka mabibigla, hindi ka maaalarma. Kasi pag nakita mo tong side effects na to, meaning, ang pasyente is responding very well to the medication. Any effects or any symptoms outside of these following symptoms if side effects that I'm going to give you is considered adverse effects, meaning the patient is not tolerating or responding negatively to the fentanyl medication. Okay? Eto na tayo. Here are the side effects. Makinig, respiratory depression. Kaya normal na lagi mong i-check ang RR mo, Q1. Okay? Sedation. Kaya nga siya binibigay saan? Sa mga pasyenteng naka-ET. Next, euphoria. Addict pala ang pasyente mo. Bradycardia. It has this parasympathetic effect. It slows everything down. Next, cardiac arrest. Kaya monitoring ang pasyente Q1. Naka-attach sa cardiac monitor para ma-monitor for any changes in the ECG. Okay? Next, DVT. Common side effects niyang DVT, kaya as prophylaxis, kailangan ng mga pasyenteng naka-fentanyl ay nakalagay ng may DVT prophylaxis, which is it's either be heparin, it's either be the receiving any anticoagulant, or a machine with what we call this AVI. AVI is one of the, external or mechanical type of DVT prophylaxis. PE, hindi physical examination or exercise. PE meaning pulmonary embolism. Next, blurred vision, constipation, hypotension, pupillary miosis, tolerance, physical dependence with long-term use, nausea, vomiting, urinary retention, rash, diaphoresis, muscle rigidity, and laryngospasm. Okay? So once again, these are the side effects for administration of fentanyl. Eto na tayo. Last na tayo kung hindi ka pa nagsusubscribe bago tayo mag-proceed sa ating nursing responsibilities, nakakahiya naman sa'yo. Mag-subscribe ka na. Eto na. Let's begin. So I list down 7 what's this? Seven health nursing responsibilities that you need to be mindful and be aware of every time that you're giving fentanyl medication. Una, perform strict documentation and inventory assessment of narcotic. Pangalawa, assess pain and vital signs, especially respirations, RRY, kasi pwedeng mag-respiratory arrest ang pasyente mo, di ba? Parasympathetic effect siya before and after dose. Next, do not administer if respiratory rate are less than 12 per minute. 12 cycles per minute. Why? Kasi nga, mababa na ang RR mo, magbibigay ka pa ng fentanyl, baka bumagsak yan, nanggigigil ako sa'yo. Next, we have pay close attention to guidelines for administration. Per hospital, you have your SOP. So please make sure to read your SOPs. Be aware of it in administering these type of high alert medications. Okay? Next, patch is used for opioid tolerant patients, not for control of post-operative pain. Saan binibigay yung mga patch? Sa mga chronic pain type. Mga pasyente natin may chronic pain. Cancers, maybe. Respiratory depression can be reversed with Narcan. Laging kapag may fentanyl, kailangan available ang antidote, which is naloxone, yung Narcan. Okay? Para you can reverse any fentanyl intoxication. Okay? Lastly, patient education. When it comes to the patient education, ano yung educate mo? Makinig na lang ha. Teach patients to avoid exposing the patch to external heat source, heating pads, hot bath, electric blankets, as these can accelerate and release of the medication, as can fever, subbathing, and strenuous exercise. Ano pa iti-teach mo? Pangalawa, teach client that if intranasal spray has not been used in 5 days, the bottle should be discarded and replaced with a new one. Pangatlo, store securely in child-resistant location. You don't want the children to be able to have a grasp on this type of medication. Big no-no, baka mag-euphoria yan, alam mo na. Next, damaged patches should be folded in half, medication side together, and flushed down to the toilet. That's a proper disposal. Pregnancy, breastfeeding, geriatric patients, increased intracranial pressure, seizure disorders, severe respiratory disorders, cardiac dysarrhythmias. Avoid alcohol, for this can aggravate the side effect of the medication. 7. Teach patient and family about central nervous system changes. Mga decrease in heavily sedated ang mga pasyente mo. For sure, meron kang alteration sa level of consciousness, physical dependency, risk, and other CNS depressants to avoid while taking, and accidental exposure risk to children and pets. Thank you so much, you guys, for watching. I hope you learned something today. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics that you want us to do. You comment it down below. Abangan nyo nga yung upload natin tomorrow for Friday. It's going to be fun. It's going to be a lot of learning. You guys, thank you so much. Please make sure to follow me in all my other social media accounts. Everything is at Neil Galve, except for my TikTok account, which is Neil Galve Official. I have a Facebook page. It's Neil Galve. And I have a podcast channel. It's 3 a.m. Conversation with Neil Galve. Tulungan nyo na nga ako, ipamalitan nyo na sa Radyong Sira ang pinakabago, pinaka-fresh at ang pinakalibreng nursing review center sa balat ng YouTube. And just in case nobody told you this, you haven't heard anyone tell you this for today, I just want to say I love you and thank you so much for coming into the class, and I hope you learned something. Go and enjoy the rest of your day. You have a good one.